So hello guys and welcome back to my channel Guide to Glory. So in this video today along with us we have Mr. Tejas Prajapati. So he is going to tell us about what all to do in medicine clinical postings during second year of MBBS. So Tejas, please tell us that how was your experience of medicine during second year of MBBS?
Well, it was nice enough. You feel the power, the respect of being a doctor, and I feel the words give you a space to apply your practical knowledge to apply your theoretical knowledge you gained into practice. So, in total, it was a nice experience.
So Tejas, please let us know that what all things should be done when you attend a medicine clinical postings, like what all cases that are commonly seen and what all procedures to see, like that.
Look, I would like to divide this whole the question that you asked into four answers or four topics, as you may say. First is prerequisites, like what you need to do in words and what you need to take to the words. Then second would be what to study and how to study. Then the third topic would be alignment, and the fourth topic would be the core values that you gain in your medicine words. So let's begin one by one. So I would start with prerequisites. Prerequisites means what you should have before you attend the wards, right? So in the medicine wards, stethoscope, then a torch, then any clinical book. There are many clinical books like PJ Mehta, Algappan, then Anup Kumar Hutchinson. So you may have any of that, and you should always wear a mask because no matter COVID is there or not, you always have a chance of getting you always have a chance of encountering the patients of pulmonary patients or TB patients like that. So you should always have a mask. And now I would like to go to the second topic, that is what to study. I have divided this topic into three subtopics. First is history taking, second is symptomatology, and third is clinical examination. So I would like to start with history taking. So basically, as they say, that history taking is an art, and you really develop this art over a period of time. And there are many books that you can study for history taking, but there are many books like I told you before, and you can also read S of surgery in history taking. And I personally feel that S has an edge over the other medicine books in history taking, because S also tells you what to do and what not to be done, whereas PJ Mehta and books like that only tell you what to be done in words. Like you may see that in S the point of that in S it is mentioned that you should not ask any leading questions. These are some points which are minor points, but they are actually missing in PJ Mehta. So I really feel that S has an edge over the other medicine books in the portion of history taking. And additionally, S also gives you a really good insight about how you should communicate to the patients and what questions should be asked. So I really think that S is a good book for the portion of history taking. And next, one of the point that I think is that the history taking should be legitimate enough, And in medicine, ruling out negative history is very important. Like I saw a patient of ascites, so there may be many causes of ascites. Like the first cause that comes to our mind is of hepatobiliary system. Then the second cause might be cardiac failure, the cause of cardiac system, cardiovascular system. Then you may also have causes of renal system. So like in ascites, like I gave you the example of ascites, right? So in ascites, in hepatobiliary, there may be many causes. Like if you ask the patient of jaundice, and if he or she had the history of jaundice, like yellowish urine or yellowish of sclera, if the patient didn't have these symptoms of jaundice, then you can rule out the cause of HCV or HBV, right? Then if you ask the sleep patterns, then you can rule out hepatorenal syndrome. Then if you ask the patient about the urine output, then you can rule out nephrotic syndrome or nephritic syndrome or other renal causes. And if you also ask about the puffiness of face, then also you can rule out the nephrotics. Then also you can rule out renal causes. So I feel that negativity is very important, and it helps in narrowing down of your diagnosis. So it's good to take a negative history after chief complaints. Then the next part is symptomatology. There are many symptoms that a patient may present with, so you must read all the symptoms that are given in the clinical medicine books. Out of them, some of the symptoms are very, very important, like like your fever, then pain, then angina, then dyspnea. Angina and dyspnea are one of the most common symptoms that you find in patients in the emergency department. So they are very, very important, and they are also very common in India. And you should know in detail about fever, pain. In fever, you should know about the types of fever like intermittent, remittent, continuous, then Epstein-Barr type of fever. Then in pain, you should know about the sites of pain, then characters of pain, like you can find heaving pain in angina, like that, you know. And you should also know about weight loss, because weight loss also is very, very common symptom you can find in the Indian scenarios. So symptomatology, I suggest you to read from book, and you should know the basics or the basic points and uh, the symptoms that are prevalent in India. Then the third part is clinical examination. In clinical examination, we also have three topics, like, you know, general survey, local examination, and systemic examination. In general survey, you may do head-to-toe examination, but I suggest that minimum of 6 points must be covered that are very, very important and very, very common, like, you know, pallor, icterus, cyanosis, clubbing, then koilonychia, then lymphadenopathy and edema. So these are very important points that you must cover in general examination. And if you have much more time, then you can go for head-to-toe examination. Then in local examination, you should know about the inspection, palpation, percussion, and auscultation. In inspection, if we take the example of per abdomen, then you should know what in abdomen we should inspect, like the dilated veins and scars, then, you know, then edema and all. Then in palpation, you should know about the anatomical landmarks and how to palpate organs and how to palpate organs. Then in percussion, you should know about the notes like dull, tympanic, then resonant notes, and you should know the areas where you can find these notes, you know. Then auscultation is tough, but auscultation is tough to master, but you must try to hear it. And what I did to auscultate, that I called a resident and I asked him to help me out while auscultating. So I still remember that when I was in the wards of pulmonary medicine, I asked the resident to ask me hear the sound of crackling in pneumonia patient, and I really liked that sound. And I would never forget for life. So, you know, you should ask the residents to help you out, and sometimes residents also guide you regarding the competitive exams you face. So it's really good rapport with them.
So yes, so guys, that they just told us a very, very important points, and few of them I would like to recall again. That one of the things he said is that you should have prerequisites. That was already discussed in our first video in general consideration, and him also told the same. So these are things that are very, very crucial. Like if you are going to a ward to study something, that you always must be properly equipped and properly prepared. That there you should not be searching in the internet. Obviously, you might find answers, but it's better if you have a clinical book along with you. And then if you see something there, then there are more chances of you to remember it or to recall it future in exams.
And I would like to add some of the other points, like, you know, in systemic examination, you should have a basic idea about the systems. You know, like in cardiovascular system, you should know what is angina, what are the types of angina, then what is MI, then what is infective endocarditis. So you should know. So you should have the basic knowledge about them, and you should also know somewhat about ECG. So, you know, you should know what each wave represents, what is the amplitude and the duration of each wave, that is called normal. So you should know about the basic concepts of ECG. You don't need to directly go to those topics like left axis deviation or right axis deviation or topics like that. You would be taught that in the later years, but you should have a basic concept about it. You should have a basic idea about ECG. And next I would like to talk about is the alignment. You know, there are two types of alignment. One is horizontal and one is vertical. So by horizontal alignment, I mean that, you know, you should read the same topic from different years, from different subjects of the same professional year. Like if I took a history of TB patient, right, then I would read the topic of TB from pharma, from patho, and from micro. And, you know, TB is an IMP everywhere, so you can also simultaneously prepare that topics for your exam. And if you study this, you would really build a very nice concept of that. Topic, and it would really help you out. And you can also do this for many of the topics that are very important and very prevalent in India. Like you can also do it for iron deficiency anemia, right? And you should follow this horizontal alignment of studying after you do the second part. That is what to study and how to study from the clinical books, right? And after you do the horizontal alignment, you may also think of doing a vertical alignment. That is, you study the topic of TB from the medicine books of final year, right? But it is very time consuming, so I suggest that you follow horizontal alignment and read the same topic from the clinical books. Then at last, I would like to talk about the core values that you may develop when you attend wards. So first of all is that your clinical skills improve, and I believe that a good clinician is someone who has the differential diagnosis in mind just by observing the patient. I have seen many doctors do that, and it's really tough. But yeah, I have seen doctors do that. Like if an obese patient comes to your OPD and he has dark flexures in neck, so you may think of diabetes mellitus. Then if a patient who has difficulty in walking, or you think that he might have joint pain, comes with a rash over his face, then you may think that it is SLE. So just by observation, you can just by observe. So be such good at observation that you can reach to the differential diagnosis. And observation is really a key in medicine, and you also develop listening and good communicating skills. And listening is very, very important in the medical field, because because with the help of listening, you also heal and you also attract. So listening is very, very important. And last of all, you can also practice empathy with patients, and that might help you build a good rapport with your patients. And it also brings trust to your patients. It helps in building trust in your patients. So this is all.
Yeah, so guys, he has told some very, very important points, and I would like to summarize a few of them. That one of the things he said is that history taking for medicine is good from surgery book. So that is being open-minded. So if you are attending a medicine board, that doesn't mean that you have to study only from medicine clinical book only, and that you can study history taking or something from medicine only. You can also uh, read history taking from any other book. Like he said, surgery book as this is very good for history taking. You can learn from it and apply it elsewhere as well. And this type of thing, I guess, will be available on my channel only. So guys, subscribe and stay tuned. So coming back to it, he also said that build a rapport with residents and ask them. Generally, what happens is because of our inherent fear, or maybe fear of unknown, or let's say we have that fear that they are senior teachers. If we may ask them, that they might scold us, or they might ask us some questions of that subject which we may not be knowing. Whatever may be the reason, we have a lot of fears, and because of reason, many times we just don't ask, even if it's there inside us, and we just let it go. So he has told a very important point, that ask the residents, don't fear, don't hesitate. In that way, most of the residents are very helpful, and they will help you to learn. They will show you the cases, they will teach you. So they are good. Build a rapport with them and learn with them. Another important point he said, that you should be a very good listener. In today's era, if we might have read somewhere something from here and there, and we are ready to jump on to give answers like, yes, sir, I know this. Yes, sir, I know that, here and that. But as he said, be a very good listener. That is also an important clinician skill. That listen properly, understand. Even if you might be knowing, still carefully listen. You might not know certain things, then you might be able to learn a few more things if you are ready to listen and ready to understand. So these were some of the points which I'd like to summarize. Coming back to this, so Tejas, please let us know that what all is asked in the exam or during board ending of medicine, and how to prepare for the same.
In second MBBS, I feel that history taking, symptomatology, and the clinical examination is more than enough. And in history taking, you should know each and every point, like family history and all the other points that are covered in the portion of history taking, and the importance of each and every point. That why we cover those points in our history, right? And I have seen many people do this mistake. Like, I'll give you two scenarios, and you tell me which is the better scenario, right? Like I am presenting a history to you. So first, his name is XYZ. Then age 27 years, sex male. Then marital status married. Then residence Dahood, and chief complaints fever since 10 days. And the second scenario is a 27-year-old married male residing in Dahood, laborer by occupation. presented to OPD with chief complaints of fever since 10 days. So you tell me, I tell you that the second point, that the second scenario is really better and it feels nice to hear, right? So
Yes.
in history, you should make sure that the history that you present is in a single line. It should not be like the point. It should not be in point wise, and it really gives a good impression. It really gives a good impression on the examiner who is sitting in front of you. And in the portion of and you should know about symptomatology, like I already discussed in the second point, that what to study and how to study. And apart from that, you should know the sites of examination, and you should know like pyloric teres cyanosis, then where we see them. And they also ask you the basic questions like then differentiate between central cyanosis and peripheral cyanosis. So you should know some of these differences. And if they ask you head-to-toe examination, like it happened in my case, so you should know what we should look for in hairs, then what we should look for in eyebrows. Like in eyebrows, we see mydrosis, like loss of lateral eyebrows in leprosy and all. So you should know what we should examine in each and every part of the body from head to toe. So I think this covers all of your examination portion. And and in exam there might be directly history taking. They might give you a patient and you have to take a history of them, or you may directly have to sit in the viva. So, and in the viva is also dependent on viva covers the portions like history taking, symptomatology, and clinical examination. So the viva goes on these topics only. So they would not ask you in much depth the other topics. So in second year, you should in history taking, you should not have the focus on making the diagnosis. Rather your focus should be on taking the history in a correct manner. But at the last, you should have some 2 to 3 provisional diagnosis in your mind. But I once again repeat that that you should not have the focus on making a diagnosis.
Okay. So, and how to prepare for it? Like reading clinical books, or there is something else you can do?
Look, I made the notes in the wards, and the residents really teach in a very nice manner. So what they tell you, you should note it down, because what they tell you is really very, very practical, and not unlike in the books, like it is very theoretical. So what the residents teach is it's really gold standard. And they tell you the practical points, and when you speak the practical points in your viva, it really stands out. So I feel that you should make notes of the residents, and you should also read the clinical books. And you should and I feel that I think that the history taking, symptomatology, and clinical examination is given in the part 1 of PJ Mehta. So you can read it from there, or any other book you have. So
Yes.
you should read the clinical examination books, and if you have more time, then you can refer the other books, as I said, in alignment.
Okay. Yeah. So before we just conclude, as you said, there are many clinical books available for medicine. But if anyone has to choose one book, or rather, I should ask the question that if what book you use, or which book would you suggest to use if anyone has to choose just one book?
I think it would be PJ Mehta.
Okay. So according to you, if someone hasn't bought any book, then it would be better if he or she buys PJ Mehta. And if someone has bought some other book, then it's completely okay. So yes, this was all about medicine clinical posting. So guys, thank you so much, Tejas, for being with us and telling us very important insights about medicine clinical postings. So that's it for this video, guys. Subscribe to my channel, stay tuned, and see you guys in this next video. This is me, Yash Gandhi, signing off.